Hi, everybody. I'm Dr. Olson. I'm a senior AME and a HIMSS AME, and today I wanted to talk to you about blood pressure and the struggle to maintain control. Today is February 17th, 2024. As a brief disclaimer, I am speaking about my experience working with pilots for medical certification, and I'm not speaking on behalf of the FAA. So, pilots and blood pressure. In general, pilots are required to be in control of the aircraft. They have to know what's going on with it and they have to be able to take action to correct the situation. One thing that's really hard for pilots is their blood pressure, dealing with their blood pressure. It's hard to voluntarily control your blood pressure in an instant, meaning during your flight physical. In my practice, probably about 60 to 70% of the pilots have some degree of nervousness when it's time to take their blood pressure during their flight physical. So the question becomes, what can be done? First of all, blood pressure is mildly controllable, both near term and long term, but for those with blood pressure issues, it takes some planning and effort. Okay. I've listed three things here. I've listed calm, lifestyle, and genetics. So first of all, being calm. This applies to more the short-term ability to control your blood pressure, in the moment of your flight physical and getting your blood pressure taken. What you really need to do if you've got blood pressure issues is to practice some relaxation techniques and some deep breathing exercises with a focus on slowing your heart rate. When you get to the flight physical, you have to try and be prepared for that. It's not easy to do, and if somebody's really got significant anxiety associated with it, it becomes even harder to try and calm yourself down in the moment. The second thing is lifestyle. So this is more of a long-term approach. Some pilots who may be overweight have elevated blood pressure, and losing 10 or 20 pounds might make the difference from passing or not passing during your flight physical. So weight loss can help bring your blood pressure down. It won't always help, but in many cases it will. And the last thing I've listed here is genetics. Now, this plays a big part in pilots who have hypertension. And if you have a family history of hypertension, it's more likely that genetics is going to play a role in your blood pressure being elevated. In this situation, it may mean that you'll need to go on a medication to control your blood pressure. But all in all, white coat hypertension is a real thing, and it's really difficult to deal with when you're a pilot in the middle of your flight physical. So take some action to be prepared for that. So FAA requirements for blood pressure. Your blood pressure needs to be equal to or less than 155 over 95 during the physical exam. Um, the FAA realizes that pilots, like, this is your job, your income, your household, everything depends on you being able to earn money for maintaining your lifestyle. The FAA realizes that your income is dependent on this physical exam, so they set the bar high for your blood pressure readings. This is not what would be considered acceptable, perhaps, by your primary care doctor's standards, but because of this being your job, the FAA puts some leeway into that. So a passing score for this um, is, like I mentioned, 155 over 95 or less. So if you're in your flight physical and your blood pressure reading is high, your AME has the allowance from the FAA to check your blood pressure more than once. So they can take it again. And a passing blood pressure means that both systolic and diastolic blood pressures need to be equal to or below the standards. So if you don't pass the blood pressure portion of the exam, there are alternative measures that can be taken, and that's on the next slide. So let's take a look. So the blood pressure pathway, you go in for your flight physical and you have to meet the standard of 155 or 95 or less. If you meet that, then the AME can issue the certificate. If you don't meet it, then the next alternative is to have 3 blood pressure readings over a 7-day period. If you're able to get blood pressure readings that are under the FAA limit and there's no changes to your medications according, to your primary care doctor, then the AME can issue the certificate. If you're above the FAA limits, or if your doctor changes your medication, uh, if a medication is added, in many cases it is if your blood pressure is consistently elevated over the FAA standard, then there's a 7-day no-fly period starting when that medication was started to determine if there's any side effects. And if there's no side effects, then the AME should be able to issue the certificate. Now, if you're taking a blood pressure medication, this is going to fall under the CACI conditions, and CACI stands for conditions AMEs can issue. That's a different presentation that I'm going to post about that. But one thing to note is that pilots who are on blood pressure medications, all of these pathways still apply, and CACI conditions are used at all of these levels depending on what the situation is for the pilot. So just be aware of that. So a little bit about blood pressure medications. There are allowed blood pressure medications and then blood pressure medications that are not allowed. The allowed blood pressure medications can work at various levels in your body. They can work at the heart level, they can work in your blood vessels, in your lungs, or in your kidneys. But the type of medication that's not allowed is a medication that works in your brain. This is called a centrally acting blood pressure medication, and it's not allowed by the FAA. So if you're new to taking a blood pressure medication, or if your doctor wants to change your blood pressure medication, you should find out if that blood pressure medication is a centrally acting medicine or not. Typically, this is going to be a last resort type of medication if your blood pressure is really uncontrollable according to your doctor, or if they're having problems trying to get it down into acceptable levels. But if you're questioning this at all, I would really encourage you to contact the FAA and ask them if this blood pressure medication is allowed. The vast majority of blood pressure medications are going to be allowed. Medication considerations to qualify for CACI conditions, you can be on up to 3 blood pressure medications. Now this can be a little bit tricky because some blood pressure medications are a combination of 2 or more medicines. In that situation, that pill, if it's 2 blood pressure medicines, it'll be considered 2 blood pressure medicines. So if you're taking 2 pills and one of them is a combination medicine, that's actually 3 medications that you're taking. If you go up to 4 medicines, then this means you're going to fall into a special issuance category. The AME, if this is the first time through this, the AME will not be able to issue a certificate, and it will have to go to the FAA for decision considerations. Some timing considerations. If you're going off of a blood pressure medication, you have to be off of it for 30 days in order to qualify. So keep that in mind if you're going to change, or if your doctor wants to change your blood pressure medications or decrease it before your flight physical. Your AME can hold the exam for 14 days. So this means that if you recall the blood pressure pathway, the first step, if you did not pass during the physical exam, was to take 7 days and to get 3 blood pressure readings. If you're doing that with your primary care doctor and your doctor decides after those 7 days that you want, or that they want you to be on a blood pressure medication, then we fall into the next 7-day category of having to have a no-fly period, wait to see if there's any side effects from the medications, and then moving forward from there. But that's going to expire the 14-day period that the AME is able to hold on to that exam and still issue a certificate if you can meet the standards. So if you're getting 3 blood pressure readings with your primary care doctor, and your doctor is deciding that, hey, perhaps you need to be on a blood pressure medication, it's going to be better to make that decision a little earlier in that process. In other words, before that initial 7-day period is up, so that you can get through the 7-day wait period to make sure that you have no side effects, and to try and get in before that 14-day deadline hits with your AME. If it goes beyond 14 days, the AME is going to have to defer your exam to the FAA, and that's just going to add a bunch more time for you to get your medical certificate. So some age considerations. I talk about connective tissue with my pilots, and this really becomes an issue in your 40s and your 50s. Now, connective tissue is throughout all of the tissues in your body. And when we're born, little kids are made out of rubber, right? Their connective tissue is very hydrated and is very flexible. But as we age, that the connective tissue becomes dehydrated and it becomes more stiff and brittle. So the 20-year-old you, when you have stressors on your system, your blood vessels are able to stretch and flex. But with the 70-year-old you, those blood vessels don't flex as much. An example of this is your near vision. This is a clue. So in your 40s and your 50s, it's very common, excuse me, for people to lose their near vision. And that's because the lens in your eye needs to be able to flex in order to accommodate for near vision. But when the connective tissue in the lens becomes dehydrated, the lens can't flex anymore, and it then gets fixed. So your blood vessels operate in a similar fashion. So things that you have to be aware of when you're coming in for your flight physical, it might be best for you to avoid stimulants such as caffeine. Caffeine makes your heart beat harder and faster, and that's going to push blood through blood vessels or these pipes that don't want to flex as much. More blood through a pipe that doesn't want to flex is going to cause your blood pressure to go up. So you may want to, if you've got blood pressure issues, you may want to avoid caffeine on the day of your flight physical. I also list diet pills here, and that's because most of them contain a certain amount of caffeine as well. And anxiety, it's just like caffeine. It's going to make your heart beat harder and faster, and again, push more blood through a pipe that doesn't want to flex, again, as you're getting older. So if your doctor prescribes a blood pressure medication, you should start the medication. And I've listed this from the previous slide about medications being added or changed and the 7-day no-fly period to check for side effects and the fact that it's CACI criteria, but that the AME is still able to issue a certificate. The most important thing is your health. I equate this to a baby, a pregnant mother who's come into the emergency room, who's injured. You could approach that situation in one of two ways. You could say, oh my gosh, we need to save the baby. Or you could say, oh my gosh, we need to save the mom. Well, the truth of the matter is, if you don't save the mom, you're probably not going to save the baby. In this case, you're the mom and flying is the baby. You have to take care of yourself in order to continue to be able to fly. Your health is the most important thing. So thanks for watching. If you want to subscribe, please do so. And if you're a subscriber and you would like me to address any particular topics, I would encourage you to please send me a message and let me know. Thanks and have a great day.